Hello, good evening. Dr. Chidi Ufondu of Snowspirations, Global Health Solutions. I hope you're having a wonderful evening and I hope you had a good day. Today is the 28th day of March 2023 and our normal clinic in YouTube. And we're going to talk about pregnancy at age 20s. What are the chances? What are the advantages? What are the risk factors associated with pregnancy at age 20s? So when you join, please announce your location. I can see the CEO of our organization, Engineer Kenneth. Thank you so much for coming. Please, this topic is very important for so many reasons. I can't even begin to tell you how important this particular topic is. But you need to be here right now. If you're a mother, if you're an auntie, if you're a grandmother, if you just have love for our girls, then you should be here right now because this topic is going to help you a lot. Now, immediately after this topic, I'm also going to repeat this topic in our Facebook page. So if you're not able to join the YouTube, don't worry. Just follow me on our Facebook page and I will repeat the topic immediately. Now I'm going to start. We're going to spend about 30 minutes. You see, when you're a woman, you're coming into this world with complete sets of all you need to be a mother. So by default, all girl child are mothers. Once you have a baby girl, she's a mother from the cradle. She's coming into this world with a complete sets of everything that will make her a mother. But she's not going to be able to start having babies immediately until she gets to puberty. By the time she gets to puberty, her reproductive system will start functioning. The most important part of the female reproductive system is the ovaries because that's where you have the eggs. This is what will make you a mother, or this is what will not make you a mother. So depending on your age, there are pluses and minuses. There are pros and cons. Now, when we talk about age 20s, for every woman, age 20s is when you have the best chance, the best potentials of achieving pregnancy, simply because at this age, you have more eggs, and not just like you have more eggs, they are of more good quality. So we are contending with quantity and quality. So the best time in the life of a woman to actually achieve pregnancy without much challenges, without much delays, it's in the 20s. But what is our reality? In our contemporary society, how many women will be ready, especially in the early 20s? Some women will start getting ready from late 20s, depending on their orientation, depending on their education level. But generally, women that are more educated will start thinking about settling down and starting their family about the neighborhood of late 20s and mainly in the 30s. But medically, the best time a woman can have a baby is within the 20s and the 30s, with the 20s being the more important time. But what do we normally have happening around the early 20s? We normally have a preponderance of teenage pregnancies. So most of our girls, most of our mothers about this period are not ready. They might be ready physically, but they are not ready psychologically, emotionally. They are not yet mature. So the fact your girl has started bleeding, she can become pregnant, but she's still a kid. She's not an adult. So majority of them just started into their teenage, youthful exuberance, hormone issues, and all that, peer pressure. So they might be sexually active. They might look like they are mature, but they cannot handle relationships. And this is the time that even one trial can lead to pregnancy. So even a lady that claims to be a virgin can become pregnant without non-penetrative sex. So This is what we need to put on the front desk. It's not about if, it's how many of our young girls in the 20s will easily become pregnant. Remember that in the 20s is also when they have a lot of risky behaviors. So naturally, becoming pregnant will be easy. Having miscarriages will be minimally reduced. Having chromosomal abnormality will be minimally reduced. So they can easily conceive, they can easily have their babies, they can have multiple babies, because this is when they have more eggs, this is when they have more quality. So they can. But it's also at this stage that they indulge in so many wrong lifestyles. So some young girls might start smoking, drinking alcohol, taking some drugs, doing so many things, not exercising, eating the wrong kind of food, associating with wrong people. So their lifestyle can predispose them to complications that come from pregnancy. But that's an acquired complications. But naturally, becoming pregnant about the age 20, it's pretty easy, pretty straightforward, less complications, and more healthy babies. So the older you are, the more you begin to experience difficulties becoming pregnant. So women in the 20s can easily become pregnant. As they begin to get to 30s, their chances begin to dwindle. Let me give you guys the statistics. If a girl in her 20s engages in non-protective sexual intercourse every month, she has about 20 to 25% chance of becoming pregnant every month. Now, this is humongous. By the time she's getting to 30, it's going to drop to 15. And by the time she's getting to 10, to 4, to by the time she's getting to 30, it's going to drop to 15. By the time she's getting to 40, it's going to drop to about 10. Then by the time you're getting above 40, it will be around 5. So think about 25% chance. So the possibility that your young girl who is hovering around the age, 20s, this is when they have their pen pal, this is when they begin to have their boyfriends, they begin to go to colleges, they begin to gain their little independence. You have to have meaningful conversation with them. Top on the list is protection. Majority of them are making love. Majority of them are actually deriving the joy of lovemaking. Because guess what? About this age is when they will have high libido. And sexual intercourse is created to be fun. So once they get into it, they become addictive. This is also the time they experiment with drugs, smoking, and alcohol. So a combination of, little independence. Probably they're in the college, probably they're in the university with little alcohol, little cigarette, little here and there. They become so addictive. This is why we have a lot of teenage pregnancies about this time. What can we do? Education. If you have young girls, start early to tell them about the implications of lovemaking. Tell them that they can become pregnant even when they don't have penetrative sex. Once they get accustomed to what happens, the same way we taught them about what happens that leads to their bleeding every month, teach them the right way of what happens during sex. Don't use a couple of jargons to confuse them. Oh, a boy will not. Tell them exactly what the penis is. Tell them what the vagina is. Tell them what happens when they engage in unprotected lovemaking. And please preach contraceptives, because no matter how good your girl is, no matter how good your boy is, the fact they are engaging in lovemaking doesn't make them bad people. It's just the time we live in. So you can see a very smart, intelligent girl, because of peer group, because of the way some people that indulge in all those things will make out of you, she might just want to try. And one day trial can put her in danger. This is also the time they have a lot of risk factors regarding sexually transmitted infections, especially the type of sexually transmitted infections that can predispose them to cancer of the cervix. So if you have girls about this age, it's important to have administered HPV vaccine, especially if you live in developed countries. By now, if your girls are in their teenage age, starting as early as 12, you should have started giving the HPV vaccine. You can't avoid this. When you give them HPV vaccine, you are actually preventing them from contracting HPV by the time they start engaging in sexual practices. And by doing so, you are also preventing them from getting cancer of the cervix in the future. You can actually give the vaccines for both the boys and the girls. So this is a very critical period in the life of our young girls. So we have to protect them. Pregnancy rate very high, fecundity very high, less probability of having miscarriages, less probability of having Down syndrome and all that because you are younger. Your eggs are younger, your eggs are of good quality, and just the normal problems that they can have might actually be acquired. So girls at this age, if they begin to drink and they begin to engage in illicit, multiple sexual partners, what's going to happen? They can pick chlamydia, they can pick gonorrhea, and what happens when they pick chlamydia and gonorrhea? That your beautiful daughter might actually have undiagnosed gonorrhea or undiagnosed chlamydia or polydiagnosed, polytreated. Some of them, because they have good immunity, it will go to their body, it will be thriving, they will think they are okay. By the time they are now ready to start having babies, the chlamydia and gonorrhea would have caused pelvic inflammatory disease. It would have blocked their tubes. They begin to have tubal problems. So they can be predisposed to having STDs and also PID, pelvic inflammatory disease, which can lead to adhesions, which can lead to a lot of problems. Now, majority of them will want to conceal the pregnancy. So this is also the period they are exposed to illegal abortion. So because they want to cover things or because they want to take responsibility, they're already engaging in lovemaking. Some of them are not using condoms. And when they eventually become pregnant, their friends will advise them to go for illegal abortion. And when they begin to go for all these illegal abortion, it can damage their reproductive organs. So as parents, as aunties, as guidance, as anything you are, as a mother you are, please let's jointly protect our girls about this age. You can see that they can look so beautiful, good, matured and all that, but they are still kids. They know next to nothing. Majority of the information they get exposed to are information that will harm them, especially in this era of social media. So let's protect our girls. Just know that pregnancy about this stage is very, very high. They have a very high rate of becoming pregnant. Only few girls are matured about the early 20s. Just very few. Very few. Majority of men that will come to marry them will just marry them because of their beauty. During the time of our mothers, because by the time our mothers were in their 20s, I know they might have married young, but they were more matured. They have multiple kids, but they have responsibility. Remember the education. They have to get education. They have to get independence. They have to know how to look after themselves. So it's too early for a girl in the 20s to think about family. It's too early. What about the education? So you will have to do this for our girls and also for our boys. Okay, so thank you so much. That's my presentation. I'm going to open the clinic now. So please, if you have any questions, which I anticipate you're going to have, feel free and ask your questions. Make it very simple, straight to point. I'll provide you feedbacks. Everyone in the clinic today, I expect you to ask at least 2 questions. Please start asking. Start asking your questions, please. Feel free. CEO, Ivy, or SARS, you guys are the only 2 people I can see in the clinic. So I'm anticipating at least 4 questions. Let's quickly get it started, please. Let's see if we can actually round up by in next few minutes. So in 20 minutes, we should have been done. It's straightforward. Ask any fertility related question. Any. I'll provide you feedbacks. Do you have any questions? Okay, here we go. At what age should parents start talking to their children about sex? As early as possible. As early as 5. As early as 6. Because guess what? Majority of the girls will start bleeding as early as 6. Especially if they have no deficiency, if they are if they are eating good nutritious food, if they are developing without any impediment. their menses will come early. So lately, girls as early as 6 have started bleeding. The moment your girl starts bleeding, she's at risk of becoming pregnant. So they already know all this. They are already playing with their electronic gadgets. The young girls, depending on their class, they are hearing about sex. So it's not like they don't know. They know. But we have to guide them appropriately. Now, what do? You tailor your message for that age. So there are specific sex discussion you can have with a girl at 6, with a boy at 6. You have to make them understand that they are girls, they are boys. You have to teach them what happens, how babies are made. Don't ever lie to them because you're going to put yourself in trouble. So don't go, if they tell you where they came from, tell them what happens. Tell them how the dad and the mom came together and made them. Explain to them. So they tailor the message to be age specific. What you can discuss with a 6-year-old is not what you would discuss with a 15-year-old. So it depends on the delivery. But start early. There is absolutely nothing you should wait for. The best time to start telling them about this, it's about this time. Where can parents get accurate information? From health professionals. Be very careful in this era of Google and quick information. Don't use them. The best place to get resources regarding information about sexual topics is from your doctors. At least until your girls and your boys are up to 18, they are still in pediatric age. So you can get the information from their pediatrician. You can get it from faith-based organizations. You can actually be the person depending on your own level of knowledge. You don't necessarily need to have medical background to know the right things. Like the issue about what happens when you don't use protection, like the issue about HPV vaccine, just tell them all these things. Make sure the information you're giving them is evidence-based. Don't ever lie to them because they will research. The biggest embarrassment you will have in your life is to tell your kids lies. They will find out. And when they ask you, you're going to feel embarrassed. They can actually embarrass you outside without knowing that they're embarrassing you. So make sure that whatever information you are passing to them is evidence-based, current, and verifiable. I love this question from Kenneth. What can happen to female reproductive system as a result of illegally performed abortion? I love this question on so many levels. You see this beautiful structure now. If they engage in illegal abortion, there are so many ways they do these things. There are so many things they put inside the vagina. There are so many drugs, there are so many chemicals that all these quacks put inside the vagina. Guess what? Any of these reproductive systems can be damaged. They can damage the vagina. They can change the environment of the vagina, which ordinarily should be user-friendly. They can damage the cervix. They can damage the womb. They can damage the tubes. They can actually lead to a condition we call sepsis. So they can have what we call septic abortion. When you have sepsis, you have overwhelming infection in your body, which has actually also affected your blood, and that's a deadly thing to happen. So your girls that go for illegal abortion can damage their body. They wouldn't even know. Some of them can have adhesions. Some of them can actually have direct damage to their reproductive organs. Then by the time they should start having babies, they would have damaged their body without knowing. So ranging from the little things like, damaging the architecture, the environment of the vagina, damaging the cervix. The cervix is a very important area in the female reproductive system. Damaging the womb. Anything that affects the womb will affect your ability to become pregnant. Of course, the tubes, you know about the tubes. And of course, your ovaries. So they should know all these things because the problem might not come now. The problem might come 10 years after, 15 years after, 20 years after. So you see that your beautiful girl, she's marrying. Suddenly, 1 year will be 2 years, 3 years, 4 years, 5 years. And the society is brutal. Depending on the environment where they live, they will start blaming them. They will start calling them names because the society already expects us to perform at different levels at a particular age. So once you marry, they will start counting for you. They will start looking at your belly. Matter of fact, by the time you're coming for the wedding, they would have been looking at your belly to know if you're pregnant during your wedding. So we're a very judgmental society. But please be the person that will tell your kids the right thing. Be their right source of information, especially sexual information. Very, very important. Okay, I love all these questions from Kenneth. Kenneth, thank you so much. And it looks like your question is the only one we have today. And we're going to soon adjourn the clinic. So join us in our Facebook page, our Facebook group. And if you're my personal friend in Facebook, you can also join us. But thank you so much. Our next clinic will be on Saturday. Remember, we are going into a new month. We are going into April. You have to equip yourself with right knowledge. Every Tuesdays about this time, you will find me. Then on Saturdays, I'll come in a little bit early, 12 p.m. Eastern time, which will be 5 p.m. Nigerian time. Then be conversant with all our clinics. And remember that every last Sunday of every month is our masterclass. Now, if you live in Nigeria, you have an advantage. Get a package, get a consulting package. Let's talk about your case. Let's see what we can do to help you to become pregnant. And let's see what we can do to help you become a mother. It's not just enough to become pregnant. When you're done becoming pregnant, we also want you to be a mother. Thank you so much this evening. I will see you guys on Facebook. God bless and bye-bye.